Hi, welcome to my talk on why things hurt. So firstly, who am I? I'm Holly Friesner, an MSK physiotherapist and first contact practitioner working for Leicestershire Partnership NHS Trust. I'm passionate about health and wellbeing and supporting people understanding and managing pain. I've done work in the past for a listening into action project with LPT, looking at improving staff health and wellbeing, and work within our MSK physio staff service. I'm really passionate about trying to bust misconceptions around pain and help people think about pain differently to hopefully help us to become more resilient moving forwards. This short session is going to cover an introduction to pain, contributing factors to pain and how our understanding of pain has changed, self-management strategies, how you can support others, and look at signposting to available resources. So why does this matter to you? Understanding pain is important. It changes the way we respond to pain and can change the way it feels. Understanding pain can improve our resilience to experiencing pain and help you manage it better if it occurs. It's understood that about 30 to 50% of people experience persistent pain. That's pain that's lasted longer than 3 to 6 months. So pain is a big problem in society, and it has an effect on our relationships, on our work life and our lives as a whole. So our response to pain is important, not only with our own experiences of pain, but how we respond to others in pain. So what we used to think, our understanding of pain used to be very basic. We used to see it as we had an injury, the messages went up through the nociceptors, up to the brain, and pain was produced. With this simplistic view of pain, we often believed that if someone hurt, if they were in pain, then the issue was with the tissues. There must be some sort of tissue damage driving those symptoms. That led to a more biomedical approach to pain. So often people would have imaging, so scans, x-rays, because they were in pain. And often we went down the line of treating what we saw on those scans, whether people had surgery or non-surgery approaches such as massage, manipulation, to try and alter the tissues. That was a very basic understanding, whereas what we now know is pain is a lot more complex than that. So we saw things as being damaged, causing pain. Now we think differently. What we now know is pain is our protective system. It's our alarm system. And the brain is that command centre of the alarm system. So the brain essentially has the final decision as to whether we're in pain or not. Having a protective system like the body has with pain is really, really important. If we've broken a leg, we don't want to feel that we can go out on a run. If we've got an infection, if we've got a wound that's not healing, we want to know about that. We want to protect it in those sorts of situations. The problem with pain is the brain responds to actual or perceived threat. So the fact that pain can be produced in response to a perceived threat is why people can experience pain without any tissue damage or injury at all. It's crucial to remember that despite pain maybe not being as a result of tissue changes, that all pain is 100% real, and it's never all in our heads, even if there are other factors involved. So our body responds differently depending on the context that we're in. So the graph on the right, that looks at the factors of a whole person, so that holistic view. So what we used to do with our previous understanding of pain was look at the tissue factors that we felt were driving the pain, which you can see in that small blue chunk. And for each person, the distribution of those blocks is going to be different. So tissue factors are often a factor in pain, but they may not be the factor driving that person's pain. So the other factors that are involved include health factors, so long-term health conditions, diabetes, respiratory conditions, obesity, social factors, so the support that person has around them, relationships, whether that be personally or at work, sleep factors, does that person get good refreshing sleep, or do they suffer from disturbed sleep? Have they not had a good night's sleep for ages? Psychological factors, so looking at mood, confidence, self-esteem, mental health issues, and environment factors, all those other things around that person. So you can see that dotted line, that represents the pain experience being triggered. And the tissue factors alone aren't triggering that, But when we add all those blocks together and create that whole person, the pain experience is then being triggered. So from a management point of view for pain, if we only look at tissue factors, if we try and massage and manipulate those tissue factors, then we're only taking away one block of that pain experience. And often if there's other drivers to that pain may well persist. So treatments such as massage manipulation might give people a short-term relief from pain, but often don't have that long-term outcome that we're looking for. So context to pain within the whole person, within their whole life, is really, really important. And that's why there's been a change in the treatment and the assessment within physiotherapy in recent years. One of the other factors that's worth talking about under the health factors, we know that within healthcare there's a large female population. The menopause can have an effect on joint pain. Aches and pains may be experienced in that perimenopause period. So we know that up to 50% of people report joint aches and pains as a predominant symptom during the menopause. So all of these factors can increase the body's sensitivity and make that alarm system ring a little bit more easily. And that's where physiotherapy needs to address the patient as a whole, which is where we've maybe moved away from a more hands-on approach, which we'll talk about later. So thinking about context to pain, the diagram's on the left. Think about a squeaky floorboard. So if you walk on a squeaky floorboard after you've had a night out, you're feeling really good, you've had a lovely evening with friends, you're walking back into the house and you stand on a squeaky floorboard. Think about how your reaction would be. Would you ignore it? Would you carry on? Would you notice it? Let's change that scenario. So you stand on a squeaky floorboard after you've watched a horror film. So a really scary film that's got you feeling a bit anxious, and then you stand on a squeaky floorboard. Would your reaction change to that? If you enjoy horror films, it may not. But if you've been ramped up, if the sensitivity of your nervous system has been raised from that experience, you might find that you get a body reaction to that pain that's different to standing on it in a night out. The context to pain is crucial. And we talk about if you change the way you look at things, the things you look at change. Often if you're dealing with persistent pain, if you've had it for a long time, if you continue to manage it in the same way, then you're often likely to get the same outcome. So sometimes it can be beneficial to change the way we look at things, and then often that outcome changes. And that's what we encourage for people living with persistent pain, but also with acute pain that's not lasting so long. If we change the way we think about it, change the way we respond to it, then our pain experience can be influenced. You might have heard this before, probably a myth, but the story goes. FedEx logo was taken to a tribe and they were asked to say, from our logo, can you tell what we do? What do we do as a company? And at this point, you're probably thinking, why is a physiotherapist talking about the FedEx logo? But hopefully we'll go on to explain that. So looking at that FedEx logo, some of you might be able to see why they came up with this answer. But the tribe said, you move things from one place to another. Some of you might be looking at that thinking, how did they get that from the words FedEx? There's an arrow. Some of you may not have ever seen that arrow, but you might have seen the FedEx logos many times before. So now we've changed the way you look at something, the things you look at have changed. And now I can guarantee you're never going to be able to unsee that arrow, and you'll be telling all your friends and family the next time you see a FedEx van. So the way we treat pain, the way we assess pain, the way we think about pain has changed in recent years with the changes in our knowledge. So this might look like a bit of a confusing diagram, but we're going to go through the numbers and what they mean. So as mentioned before, we used to treat people with more of a biomedical model, looking at imaging, looking at finding out the reason that person is in pain, what tissues are damaged, what tissues are changed. So back pain is a very prevalent problem, kind of our top referring problem, and our staff physiotherapy service, that is the majority of the people that we see are people with back pain. So often back pain can conjure up fears around disc bulges, prolapsed disc, spine being out of alignment. And often people want imaging if they've got persistent back pain. But what we now know is actually having imaging, having a scan of your back unless we suspect something sinister or serious, can be quite unhelpful and in some cases can actually be harmful. Because what we now know is that imaging often picks up age-related changing. So things that are normal that we see on any scan of any person. So this diagram shows individuals without any back pain, and it shows the MRI findings on these people. So if we look at the categories down the left, we've got things like disc degeneration, bulging discs, disc protrusion, degenerative facet joints, so all things you might have heard. And then along the top, we've got the age of the population that was scanned. So remember, these people have not got any back pain. So if we look at the changes that we see as early in the 20s, we've got 30% of 20-year-olds that were scanned with bulging discs. Therefore, the problem comes if someone has back pain without any sinister features or serious features that we need to scan for, and we take that person for an MRI scan, we might then come to the conclusion that that bulging disc is directly related to their problem of pain and treat it. But that person might have poor sleep, they might be overweight, and actually those imaging findings might just be incidental. They might have been there before this person had any pain, and it might be there on the next person that we scan as well. So it's really important that we correlate MRI findings to the clinical symptoms, and often it is an age-related finding. It is a grey hair of the joint essentially, and those changes aren't necessarily worrying and don't necessarily need treating. As we go up the ages, you can see in people in their 40s that increases to 50%. So half of people in their 40s, if we scan their backs, would have bulging discs. Therefore, discs aren't necessarily always a problem. They can be, but not always. Go higher up, disc degeneration. 80% of 50-year-olds without any back pain had disc degeneration on their scans. So as you can see, the prevalence of these findings on our scans become more and more as we get older, which is why we now consider changes that we find on imaging often age-related changes that don't need intervention. So our findings are that as we get older, we are more likely to experience these things, but sometimes the pain isn't to do with issues within the tissues. And sometimes having a scan and thinking that this is why we're in pain can be harmful. So if we go all the way up to your 80s, you're looking at 96% have disc degeneration, 84% bulging disc, 83% facet degeneration. So as you can see, the value of scanning isn't there. If we can see age-related findings, that is something that we can predict. So scans have their place definitely, but only when we suspect something more sinister or something serious. If someone had weakness in the legs or they had numbness, pins and needles, those sorts of symptoms may then warrant going down an imaging route. But most people with back pain, especially back dominant pain and no leg symptoms, don't benefit from MRI scans. So this is talking about back pain and MRIs within the back, but these findings are mirrored across the body in different joints, especially kind of in the shoulders and the knees. We find these changes on imaging. Therefore, treating people on the scan doesn't often help. So why this has changed what we used to do. So it used to be more of a hands-on approach. We used to think about a knee joint as the patient walked in the door rather than the whole person. Whereas now what we know is there are so many different factors that can influence pain, it's important to think of the person as a whole. So we used to be very hands-on. Most patients that enter the department would get a hands-on intervention. We're not hands-off, we do use hands-on where appropriate, but we no longer see hands-on as the thing that's going to fix a patient. So rather than a fixer, a physiotherapist is more of a coach. We look at the different aspects of that person's life that might be increasing the sensitivity of their nervous system, that might be making their alarm system more likely to ring, and hopefully help them to find ways to turn that down, whether that be lifestyle changes or getting fitter and stronger through exercise. So really with physiotherapy, a lot of our treatment has now moved more towards education, advice, empowering the patient in knowledge, and trying to look at busting some of those misconceptions around pain. So often pain has quite a vicious cycle attached to it. So if someone's in pain, if we worry that we've done damage, then often we stop moving. By stopping moving, sometimes we put on weight. We then become less healthy in ourselves. Often our confidence might drop. We might have mood changes, and all of those factors in themselves then make the pain likely to increase. And we end up in this vicious cycle that's quite difficult to get out without guidance. So we need this cultural shift that pain equals damage, therefore rest. And that is still something we come across a lot. And there are still health professionals out there recommending rest. In absence of injury, patients very rarely need to rest. So a large proportion of the patients that we see in physiotherapy haven't had an injury. They've had pain that's come on. And often when you unpick their story and the onset of their pain, sometimes it is around a lifestyle event. So whether they've had a death in the family, whether they've had a relationship breakdown, a period of stress at work, or they've maybe had a busy life for a few months and they've not been able to attend the gym. So they've lost some of that conditioning that they've built up. Maybe they're going through some stress and anxiety and they've turned to comfort eating and their weight's gone up in that period of time. So very rarely do we see patients with a specific trigger to the onset of their pain, and often it is around these lifestyle factors. So our assessment has changed. We talk about sleep more, we talk about stress more, we talk about mood more, all those factors that we know can contribute to this person's pain experience. So rather than seeing the mental health and the physical health in isolation, we now see it as the general health and well-being of that patient rather in isolation. So what you can do for yourself. So often if we can do these things, we can build our resilience to experiencing pain. We can never stop ourselves from experiencing pain in any situations, but we can often build our resilience to reduce that risk of injury and pain. So the one that physios commonly talk about a lot, exercise. So we know that people that exercise regularly can reduce their risk of joint pain, injury, and associated problems with muscles and tendons. So exercise-wise, we recommend 150 minutes minimum as per national guidelines. And the important thing with that is it's recommended to do 2 activities per week, which build strength. And commonly in our practice now, we are finding people are getting more active. It's out there a lot how important exercise is for your general health, but often people are hitting the 150 minutes of cardiovascular based aerobic exercise, so whether that be walking, swimming, something that gets you slightly out of breath, but they're not necessarily hitting that strengthening activity. And that's often where physio comes in, to encouraging people to work on strength, especially as we get older. Our strength, our muscle mass does reduce year on year, so it's important that we have those strengthening based activities in our daily life. That might be resistance training, weight training, doing some body weight training at home, whether that be squats, raising up onto heels, doing some presses on the wall, lots of different things that you can do at home if you don't want to go to the gym, or carrying heavy shopping bags, heavy tasks around the house. But the strengthening aspect of it is really important to build the resilience of our muscles, bones and tendons to put them at a lesser risk of experiencing pain. That becomes even more important for postmenopausal women and women in general, where the rates of osteoporosis are higher. So doing weight bearing, strengthening based exercise is really important for bone health. Things like mental well-being goes hand in hand with exercise. Often people that exercise regularly have better mental well-being and vice versa. So trying to do things, activities of self-care, meaningful activities that help you look after you. And often if you are in a stressful period, if you live in a busy life, we often put ourselves at the back of the queue for that attention and that priority, and that needs to change. We know that we can help and support others better if we're in a good place ourselves. So self-care is very personal. There might be things that you do with other people that you enjoy. You might prefer to do things on your own, things like reading, listening to music, painting, all sorts of things can help with your mental well-being, but it very is much kind of what works for you. Sleep, we know sleep's a really important factor, and that's become more prevalent in pain knowledge. A lot of people that live in persistent pain don't sleep well. So we need to be having roughly 7 to 8 hours of refreshing sleep each night. So you should wake after that sleep feeling ready for the day. So some people might get the of hours they need, but might not necessarily be getting that refreshing sleep. That's something worth looking at if you are experiencing pain. Weight management, so holding excessive weight obviously puts mechanical stress through the joints. However, there's also a lot of information, a lot of evidence around the fact that holding excessive weight, the fat cells do influence inflammation within the body, which can also contribute to pain. So even losing a few pounds can have a positive effect on pain. So all of these things can help manage pain when pain occurs, but also focusing on these aspects can build your resilience as a human being, improve your health and well-being, so put you at a lesser risk of experiencing pain and injury in the first place. So if you think back to the alarm system of pain, that protective mechanism, it's less likely to be sensitive if we're looking after all these things. So if you think about a stub toe, so you might be having a really good day, everything's going fine, sun's shining, you've got a to-do list that you're ticking through nicely, and you stub your toe. You might say, ouch, and carry on. If we change the scenario, so you're not feeling well in yourself, you're feeling run down, you're feeling tired, you're getting the shopping bags out of the car, the rain starts to fall, and then you stub your toe, then that stub toe is probably going to feel a bit more sore and be a bit more effective on your day than the stub toe in the previous scenario. So we know that if we can change the context of our life, if we can improve ourselves and our health and well-being, then our pain experience is different. So what you can do for others. So as I mentioned at the beginning, how we respond to other people's pain is really important. For example, if someone's complaining of back pain at work and your first response is, oh, what have you done? Have you damaged something? Have you asked the GP for a scan? Then sometimes that can just reinforce the belief that pain equals damage. But now what we know is you can be sore, but you can be safe. So that hurt and harm don't often balance. And if we can change the cultural beliefs around pain, then our response to others in pain is likely to change. And if you think about the vicious cycle that people can come into with pain, then having a more positive effect on that can be helpful. So, for example, if you're a manager with employees that are experiencing pain, talking about the other factors such as sleep, regular exercise, or encouraging them to go for a walk and walking meeting, those sorts of things to try and get out of that vicious cycle, and maybe talk about pain in a different way to what you have done previously. Friends, family as well, how we respond to their pain is really important. So often, and I have it myself, if you experience pain, often people tell you to rest. I'm a runner. Often if I've got knee pain, back pain, my family is saying, well, don't go for a run today. Whereas I know as a physiotherapist without injury, there is a good chance that I can run. I might have to do a shorter run. I might have to do a slower run, but there's no harm in running. So actually by keeping running, I'm going to keep my muscles strong. I'm going to keep my mood up. I'm going to keep my weight down. So actually the benefits of continuing to run on my pain are likely going to be much more positive than stopping running, resting because I've got pain. And then unfortunately by resting, my muscles are going to get weaker. I might put on weight. I'm not going to feel as well in myself. And then my pain experience is likely to last and is likely to be more significant and have a more significant effect on my wider life. So how we approach pain is really important. One of the other things that we've worked on within our trust is how we talk about preventing pain and talking about how our body is resilient. So things like back pain, our back is resilient, it's strong, it's made to function, it's made to bend, it's made to twist, it's made to lift. So if we err on caution with how we move and tell people to protect themselves or be cautious with movement, then often that can make people believe that they are more fragile and they need to be careful. Okay, so things like bending and lifting for back pain are often kind of talked about in fear-evoking ways, suggesting they're damaging to the back. Whereas what we know is if we're used to doing activities and we're fit and we're strong and we're well conditioned, bending is not going to cause any harm on our backs. What might happen is if we're not well conditioned and we bend, then we might have a strain, we might make things sore, but we're not necessarily going to cause damage. So we should talk about empowering our bodies and how strong and resilient they are, but we need to look after them to keep them that way. So things like sitting up tall, be careful of your posture, watch your posture. You might get back pain, you might get neck pain. There are often things, and we talk about it from a very young age. Kids get told off for their posture from a very young age and get told, oh, you'll have back pain if you slouch. Whereas actually a lot of these things are myths. So we know that there is no one perfect posture. We can sit how we like, how we are comfortable. The key is changing postures regularly and not keeping one posture all day long. So often some of these misconceptions around pain and our discussion around pain can actually make things worse. It can make people more likely to experience pain, and then also when the pain's there, make it more significant and more catastrophic in its effect it has on that person's life. So understanding pain, understanding why pain occurs, and understanding how complex pain is really helpful in the way we respond to it. So we know that self-management is really, really powerful. So if you look after all those different factors, and if you think back to that bar chart that we had, so your health factors, your psychological factors, your sleep factors, if we can contribute to all of them, if we can be exercising regularly, if we can be getting good quality sleep, if we can keep our weight managed and eat a healthy, balanced diet, if we can be doing good self-care, meaningful activities regularly to look after our mental well-being, then we can reduce our risk of experiencing pain or injury. But we may experience pain or injury. You can't prevent that from happening. So if you do experience pain, in absence of an injury or any sinister features, then try to keep moving. But what we understand is you might be doing all the right things in the best intentions, and that pain may still be troubling you, that injury may still be troubling you. And that's where Trust's MSK staff physio services are there for you. You can speak to GPs or other health professionals, but hopefully having better understanding of pain can reduce your experience when it happens, but also reduce it from happening in the first place. So there is now, as I discussed, some great change in our understanding of pain and why things hurt. And there's lots of really good online resources, which a few are listed there. So Pain Ed, Retrain Pain, Flipping Pain and Pain Toolkit are all really good websites to get up-to-date evidence-based information and resources about pain. So hopefully this talk will help you do something for you, possibly your patients and also the people around you. So final thought, pain is complex. Understanding pain changes the way we respond to pain in ourselves and others, making us more resilient. Thank you. If you'd like to follow us, we have a Twitter page at LPT MSK Physio, where we post regular stuff on health and wellbeing, and also on the videos that we've created to support people getting more active at home during the pandemic, and some education videos around topics like pain, sleep and stress. Thank you.